The Hawkins-Kennedy test is a test for shoulder impingement, and by nature it's going to be our sensitive test for the shoulder. Meaning you do shoulder range of motion, active, passive, overpressure doesn't hurt, then you would implement the Hawkins-Kennedy test. It's a combined motion, and if active range of motion and passive range of motion with overpressure are negative, then you would do this test. If active range of motion is painful, then you would not progress on from there. Here's the performance of the test. Here's an alternative option. That is more the coracoid impingement test. And here is another alternative. Let me go back over these. And the first option, how it's typically described is you bring the arm up. So this is the frontal plane here. And what you're going to do is bring them forward from the frontal plane about 30 degrees. Typically described in a plane of the scapula. So they are horizontally adducted, approximately 30 degrees. Try to prevent the shoulder from elevating. In this case, one hand is on the elbow, one hand is on the wrist, and you are taking them into internal rotation from that position. The theory here is you are mechanically impinging or abutting the humeral head up against the glenoid, which would be impinging the rotator cuff, the shoulder labrum, and whatever else, synovium or whatever else. Now, the issue with this test performed this way is oftentimes patients in pain, or if you don't control them very well with your arms, their shoulder will elevate or hike. And so then an option is to do what I'm doing here is the most caudal hand grabs the elbow, the most proximal hand depresses their shoulder so that it doesn't rise up, and then you do the same test. So now you can control the shoulder from elevating. The issue here is your hand big enough, and can you control their entire arm with your hand alone? And so for me, either option works fine, but in some cases, so then here is the Hawkins-Kennedy test. Some people will do it straight in the sagittal plane. Some experts would suggest that this is a coracoid impingement test, but you may see it done in the sagittal plane. Typically, it is performed in the plane of the scapula. A next option, the third option, is to use the right arm in this case, come underneath the elbow, stabilize the shoulder, get away from blocking the forearm. So your forearm cannot block their forearm from moving. So you have to make sure you are posterior enough on the elbow or behind the elbow as much as you can. And then you're going to cross over your other arm underneath. So you can see I come underneath, my left arm comes underneath my right arm, grabs their elbow, and then pulls them into shoulder internal rotation. This is probably an option for somebody that doesn't have big enough hands or can't control the shoulder from elevating. This is another option, but watch where my forearm is. See how it's far enough back that it's not blocking the forearm from going down or making the shoulder go into internal rotation. You cannot block the motion, otherwise it'll give you a false or potentially a false negative. I don't have the statistics on here, but you can look in the book and you can see it's a relatively sensitive test in different pooled analyses. It's in the red, so it's a sensitivity of 80%. It's not overly impressive, and the negative likelihood ratio is only 0.35, which is in the small range. So this would be in the yellow quadrant of caution, but this is our sensitive test, and so it is what we have. I hope you found it helpful. Take care.